the moderator, esteemed panelists and guests, colleagues, friends. Thank you very much for this opportunity to reflect on the challenges we have faced as we continue to fight towards the elimination of TB in the face of COVID-19 pandemic. In November 2019, the WHO-led joint review of the HIV, TB, and PMTCT and viral hepatitis programs found that we were on track to attain the 2020 milestone of a 20% reduction in TB incidence rate. At that stage, we did not have any inkling of the storm that was soon to be upon us that would threaten these hard-earned gains. In addition, the results of the South African National TB Prevalence Survey have shown that the incidence rate is actually higher than initially estimated, and that there are about 154,000 people in our communities who had TB and had not been detected. While the target for TB mortality was partially achieved, a significant decline of 19.6% in HIV-negative TB mortality has been recorded, and this is encouraging. As we have reported in the Global TB Report of 2020, our treatment coverage is 58%, whilst the treatment success rate for the drug-susceptible TB is 71% and 60% for drug-resistant TB. Clearly, this falls short of the national and global targets. However, as I will elaborate in a moment, we have an opportunity to leapfrog towards the desired targets for these indicators by leveraging of the systems we have built and strengthened for the COVID-19 response. We're awaiting the results of the National TB Patient Cost Survey, which has just been completed. This survey aims to determine out-of-pocket health expenditure amongst TB patients and their households to estimate the level of costs to the user. This will assist to inform the implementation of our iteration of universal health coverage, the National Health Insurance, by which we have explicitly expressed in the bill that under NHI, no citizen should pay out of pocket for their essential medical expenses. COVID-19 has certainly made its impact felt in the national TB response. Since the hard lockdown began in South Africa in March 2020, there has been a sharp decrease in TB notifications, patients being initiated on TB treatment, and patients accessing essential health services for the screening, testing, and treatment. Our approach to managing the TB burden in the context of COVID-19 pandemic is to leverage the gains we have made in the health system strengthening over the course of the pandemic, extract valuable lessons learned, and employ those strategies in the national TB response. For example, we are well known for the proactive community screening and testing campaign, which we adopted at the beginning of the COVID-19 pandemic. This strategy not only allowed us to identify high transmission and low transmission areas, but also gave us an opportunity to engage communities on the ground to do better, to better understand the socio-economic determinants that also need to be comprehensively addressed by government. It also gave us a means to educate the community and for citizens to educate us. Our provinces have been mobilized to intervene using the following strategies. First is the demand creation through communication, social mobilization, and civil society engagement. Next is the integration of TB, COVID-19, and HIV services. Thirdly is the strengthening airborne infection control practices in our health facilities. And next is exploring innovations to ensure treatment adherence and leveraging COVID-19 digital health solutions and improving access to social protection for eligible TB patients, and this will be by the results of the TB patient cost survey. Expanding eligibility for latent TB treatment to all households contacts of TB patients, including shorter regimens for the treatment of TB. The South African National AIDS Council, which is led by Deputy President, is currently developing a multi-sectoral accountability framework for TB to ensure that interventions adopted have relevance for our people and achieve the national and international goals towards eliminating TB. Despite all the challenges faced, we remain committed to improving access to appropriate, efficient, affordable, and quality health services for all South Africans and to eliminate TB by 2030. We must thank our development partners, technical agencies, the business sector, and civil society who have forged strong partnership with us towards this goal. We believe the COVID-19 pandemic should be seen as a wake-up call, an opportunity to build resilient health systems and to commit to social solidarity for the good health and prosperity of us all. I thank you.